Hi, everyone. Welcome to our monthly discussion and talk with Dr. Linda Birnbaum. This is part of my anniversary series going on this year. Very happy to have Linda joining us. She is a toxicologist, a microbiologist, and the former director of the National Institute for Environmental Health Sciences, and as well as the National Toxicology Program. And this is a position that you held for 10 years. So you certainly got your feet wet. And I know a lot of us out here really appreciate so much your leadership, and particularly around children, vulnerable populations of all sorts. But it was very clear, working with you, being a part of your science board was an honor. But just, moving in and shaking and testifying and together on the Hill and joining meetings together and just trying to be the change agents collectively. I always found your leadership at NIEHS and others before you certainly to be such a wonderful extension of the academic, government, non-governmental partnerships that were and community level partnerships that we're always yearning for. So I know a lot of us were sad to see you leave that position, but at the same time, I know you're still doing a lot of research and certainly still maintaining your roots in so many ways and extending yourself at the citizen level, which is also very exciting to see. So welcome.
Thank you.
So yeah. So I was hoping you could first walk us through, your journey. I think it's really important for our listeners, and they're all ages and all levels of their career paths. Some of them, just dabbling in environmental health and science and academic science and all of that. Would love to just hear your journey. What kind of, at what point did you discover you had this passion for environmental health research, toxicology, all the above? Would just love to hear the story.
Well, I think I actually was asked to write an autobiography a few years ago, which I did, which is called, I think, My Winding Journey. And I think that's a fit metaphor, because I never was one who knew exactly what I was going to do down the road. But I always took advantages of opportunities, and I was willing to take a chance and make change when necessary. So, I mean, I started off really, my training says microbiology, but I really was a molecular biologist. And that's an ancient history. At the time that I finished my PhD, you didn't even have restriction enzymes, hadn't been identified yet. And so I decided I wanted to move from working with bacteria and viruses. I was going to move to the big time. So I started working with yeast and did work on mitochondrial biogenesis. And then from there, and that was really strict biochemistry. And then from there, I actually moved into what I would say was kind of pharmacology, and was looking at altered metabolism and was trying to understand why cancer is a disease largely of aging that goes up with about the fourth power of age. And what we hypothesized that it was related to differential metabolism of environmental chemicals, things that we encountered, like benzpyrene, something like that. And that's where I made the acquaintance of some of my favorite molecules, PCBs and TCDD. And frankly, what happened at that point is my husband and I were living in upstate New York. We lived a couple places, and we've very personally got tired of it snowing on Halloween and snowing at commencement. And we decided it was time for a change. And I was lucky enough to get a position that was called the Senior Staff Fellow at NIEHS and the brand new NTP, and came down to North Carolina. And I think the rest is history. That's how I got into toxicology. When I first came down, I didn't even know what the word meant. I had to look it up. And I would say, I kind of followed my nose. When there were interesting things, interesting paths, I followed. But if anyone had told me that 40 years later, I'd still find chemicals like PCBs and dioxins, and actually a bunch of other persistent organic pollutants, fascinating and interesting and kind of scary, I'm not sure I would have believed them. So that's kind of how I got where I got. I mean, taking advantage of opportunities.
Yeah. Thank you. Absolutely fantastic. And somehow I don't know that I ever realized you lived in upstate New York for a while on top of all that.
Did.
Yeah. Being from the Buffalo area, I can appreciate the desire to be there, and then the desire to look at other things.
Right.
Because of the winter. Although the winters have changed a bit, sadly. But Well, thank you. That's extremely exciting. And I think it just shows once again, for those listening, take full advantage of what comes your way. You just never know. I've always said there's always an experience, well, even if you see it as a negative or something not as exciting to you, there's always many lessons learned, usually, even by going down into those rabbit holes, if you will, exploring them for a bit and coming back up. You just never know where these connections and experiences will take you. So glad you had them.
I did.
Well, moving on to the pandemic that is impacting all of our lives. I know both of us have been, healthy, thankfully, and safe in our families as well. But, this is a lot, and it still doesn't mean that the mental health issues are not there and all the implications of our lives. And certainly we know many other families are suffering daily by many magnitudes of order. When we look at the vulnerable populations, frontline workers, children, seniors, there's a variety of them. They've always been there. We usually find them a lot in our environmental health fields. And it's not sadly surprising that these are also some of the same communities suffering or being impacted. And we still don't really know all, right, of the story. But I'm sitting here in Maryland, you're in North Carolina. It's very possible that by the time this airs, Maryland will be yet under another stay-at-home order, along with probably other states in the US, because this is kind of where we're at. What advice might you have for those that are trying to be out here leading in public health, trying to obviously be good stewards ourselves within our communities, our families, when it comes to those that just continue to resist these basic public health provisions that have been pretty continuous from the public health, medical, nursing side from the beginning, as far as wearing masks, keeping your distance, reducing your interactions with people you haven't seen, keeping the groups to a minimum, being outdoors, I know you don't have a magic wand, but any advice you might have for the rest of us that are, all living through the same thing and frustrated?
I think we are frustrated because we think it's obvious. We think the public health messages are really important. I think I've kind of think of a couple things. We have to continue to model the behavior that we want. I think we have to continue to educate, and I think we have to communicate. And by communication, communication is not just message delivered, it's message received. And I think we have to work, and I don't think we've done a great job of this yet, but work harder with the communities that are resistant to the message and understand from them what it will take for them to change their behaviors. Help them to understand and let them educate us what they need to know. I think a lot of our messaging has not been as effective as it could be. I mean, part of that is because there's been mixed messaging. And I think going forward, we may have more of a single message, but I think we need to work with those people. We can't just ignore them or hope that they'll come along. I think we have to actually work with them and understand what is their hesitation, what is their resistance. For many months, at least here in North Carolina, many people would say, well, I don't know anyone. Sure, I hear about these sickness and death, but I don't see anyone. Well, it's hard for people to say now that they haven't seen anyone.
That's right. No, thank you. Also very true. And especially the point that I think is hard even for folks sometimes on the other side of things, public health. I mean, a lot of us are entrenched in these issues. We talk about prevention daily. One of the things I've said in 20 years is that basic education of how one's impact out in the world actually does impact in a positive or negative way, usually. Sometimes that basic form of education is still very void. It's still very much missing. And I think that this has only shown this, it's brought this to light, unfortunately. And it's very emotionally charged, as many public health issues are, right? So once you start getting emotions involved, I don't know, but people may not be thinking as clearly if they're a small business owner trying to keep the business open, or very stressed at home with the children home. There's a lot of factors here, but thank you for that view. A little bit more on COVID. I say a lot, I've been speaking a lot, the intersections of, again, what I see as playing out, that's very similar, sadly, to what we see playing out when we talk about vulnerable populations in our society. And I say a lot that COVID has unleashed the underbelly, if you will. It's exposed the underbelly. And this underbelly of a wide variety of social ill concerns, community concerns, didn't happen overnight. but I believe it's gotten even worse. And COVID, and fill in the blank, it could be any other virus or major public health crisis in the future, will continue to do so if we don't get our ducks in order, right? Understanding we can't solve all things tomorrow. How might you give some advice as far as the lessons learned those of us in public health, environmental research need to be obtaining? You've started to get into some. We need to better try to understand the other points of view so that we can, have a better understanding together collectively for a path forward. And beyond that, what are some lessons learned here that we should not miss? Maybe the next time around, if hopefully we don't have that. But
well, something that I've said for years, you've heard me say, we have to work with the people who are impacted. We have to work in the communities. We can't be telling people what to do without being part of the communities. So the importance of community involvement and community engagement, not just top-down messaging. The same point, we need coordinated messaging coming from the top. We can't have different people saying very different things. There's, our whole country is limited in terms of its science literacy. And people find the science difficult to understand and haven't made, there hasn't been enough effort to try to increase the science literacy. And I think people think that what science tells them at one point in time, say with a pandemic, has to be true the whole time. So we've heard a lot of discussion about, well, back in April, Tony Fauci said you don't have to wear a mask, and then they changed their mind, and now they've changed it again. Well, that's how science works. As you learn more things, you have to modify your understandings. But I don't think that the average person understands that. I think people think science is fact and it's true. I mean, that's assuming they trust science at all. And I think the kind of the moving nature of science is something that we have to work to help people understand, but it has to be by engaging with these groups, and especially the vulnerable populations. And, many of our vulnerable populations are vulnerable to everything, not just the pandemic, not just heat waves, they're vulnerable when it comes to nutrition, having often inadequate nutrition. They're vulnerable because of lack of education or lack of ability. We'll tell people in some of our vulnerable communities, you're supposed to distance yourself. Well, if you've got 10 people living in a 400 square foot apartment, people can't distance.
That's right.
And we have to understand that that's the reality and find ways to help people deal with it.
Yeah. No, totally agree. Thank you for that. It's so true. And again, we're seeing it play out daily. And I would say most people would not counter the fact that everyone, especially young children, should be wearing seatbelts, for example. But that was not the case just a few decades ago, right? It was very common. Most people understand, I think all people understand the negative implications to smoking. For example, it's not as sensationalized as it used to be, right? All in the movies and the TV shows, and obviously with all the bans, indoor bans and whatnot across the country. So we do have precedents here, right? If folks really do think about the norms and the change that science brings. But I do find it interesting how serious people have gotten about just kind of digging in and just really saying that this is a change. No, really, this is how we've always been. We evolve and we're okay with that. And we need to be okay with that or else, right? But so shifting a little bit to some of the other important topics of the time, climate change, I do believe in the Children's Environmental Health Network talks a lot about it being one, if not the biggest children's environmental health set of issues, because it connects all the above: air, water,
Right.
access to food, even birth, implications. We know are linked to, like you said, rising heat index, to name a
Right.
few. And of course, we know it exacerbates a lot of the pollutants in our air, in our waters anyway. So there's so many confounding positives that could happen by us, having a positive impact on our carbon footprint, as well as our air pollution and our water pollution and all the above. But with that, what might be your suggestion from your lens of the world for evidence-based resilience strategies? I mean, we all are trying to uplift out here what is working well. That's one thing
Mhm.
CEHN does, I think, very well, identifying places in the country. Maybe they don't have it all figured out, right? Who does? But they're at least going in the right direction. And they're showing evidence that communities and especially vulnerable populations like children are benefiting from the efforts. Do you have any thoughts on this arena?
I've spent more time thinking about opportunities for mitigating some of the climate change, which I think is still possible. I think as we move to clean energy, reduce our carbon footprints, reduce the global emissions, one thing people don't think about sometimes with environmental health is that a lot of the causes of climate change are related to fossil fuel production and use. And the products of fossil fuels are, many of them are the environmental chemicals and the plastics and stuff that we're having to deal with. So I think in some ways, again, we need a more integrated approach to look at the totality of what we're dealing with. Certain things are not going to reverse. We're close to 2 degrees C, and that probably isn't going to go away. And it's a very hard sell to tell people that climate change is bad when here in the middle of November, we have 70-degree weather. People love it. They think it's great. On the other hand, they also see the flooding. Look at what we've had 30 hurricanes or something this year and more coming very late, very strong. I think what people don't also understand is that this pandemic may not be our only one going forward. It's a very small world, and a disease that arises in one corner of the world is not going to take long to be everywhere. So we have to be better prepared for that. But some of the pandemic, I believe, is driven in part by some of the climate change impacts. In other words, where there's more contact, certainly between certain species and people. For example, the growth season, like for insects, is much longer. If you look at Lyme disease, it's several weeks longer that you have that susceptibility. We're finding not only vectors having longer seasons, but in different places. So I think these are some of the kinds of things that we have to think about and figure out how we're going to deal with it. I have to say that we were all very concerned about the Zika epidemic that happened in 2015-16, seems to have gone away. Does that mean it's really gone, or is it just in hiding? But, I was horrified when I heard that down in, I believe it was Dade County, they were heavily spraying with NALED, which is a brominated and chlorinated organophosphate poison, which we know is really developmentally problematic. So we have to kind of think about what we're doing before we move to do it. And we have to think, I guess, more holistically in it. Not sure that was a very organized answer, but had a couple good thoughts.
Very, very good thoughts and right in line. And I'm so glad people are hearing that, not just from me all the time, but we echo a lot of the same sentiments for sure. I mean, and COVID, for example, is that even if we're going in the right direction, to thinking about some of these things, these crisis moments, as much as we can prior to being in them, because then we don't seem to make sometimes the best decisions, right? A whole bunch of hand sanitizers does not substitute basic hand washing, for example.
Right.
We're very concerned about all of that. And of course, all the plastics used to now get these hand sanitizers in just about every small mart, big mart you can think of, right? So,
and then say it's not only the hand sanitizers, it's, anything you buy now, any food you buy is in some kind of plastic or styrofoam kind of container. Initially we were being told, oh, don't use your recyclable or your reusable grocery bags, use the plastic because they're safer. Well, it turns out they're not safer. But the point is the amount of plastic is just so overwhelming. To go to a beautiful beach and, you're making a sandcastle and there's all this kind of green and blue and yellow, teeny little pieces of plastic. You need to realize that's everywhere and in all of us. So, I think we have to start moving and making this recognition of what's important going forward.
Yes, prioritizing, exactly. Thank you. Well, we're also living during quite an interesting time here with this little thing called a presidential election. And I think we both talked about a bunch about this, that it's been quite a stressful time, anxiety driving time for many. And then transition, should be beginning about now to the next administration. So there's much to address, right? And the Biden-Harris administration has made it clear that racial injustice, climate change, pollution, I think air pollution, other pollutants as well, and COVID and the economy are all
Mhm.
very much high on their list. So no small task by any means. And again, just saying what I said earlier, it's not like even through the Trump administration that all of these ills totally started. It's only been magnified even more, unfortunately. And communities are suffering, right? There's a lot
Mhm.
going on. So with all of these pillars that I do believe naturally do intersect in many ways, certainly having implications on children's environments and their nurturing and development into their adolescence and eventually adulthood, what might be your advice for those of us here in the NGO community and beyond when we think about truly progressing forward? I mean, how do we even begin to align ourselves, prioritize, and really just get going with the work of the people and protection?
I'm a believer that a lot of this comes from the bottom up and goes back to the issue of engagement with the communities. I think when we can involve our vulnerable populations in making their own decisions and figuring out what's best for them, I think we'll move, I think we'll make more progress, and I think it'll help. It's interesting. At least 13 million deaths a year, according to WHO, are due to the environment. Probably more than that. That's a real minimum. And about 9 million of those, 8 to 9 million, are due to air pollution. What we don't think about is that, especially in our vulnerable communities, a lot of that air pollution is indoor air pollution. And we think of like indoor cook stoves, or not everybody thinks about it, but I think about it, and you think about them as being in developed countries and the problem with burning, for example, different biofuels, charcoal or dung or whatever you're burning. But, it's a problem even in this country that we have small areas. We have people who are cooking and heating, for example, with wood stoves, which we know leads to a lot of indoor pollution. And then we forget that, for example, our wonderful natural gas, which is less polluting ambiently than burning other kinds of fossil fuels. But the problem with it indoors, it's one thing if you're in a McMansion, you've got plenty of space for the nitrous oxides to be. But if you're in a very small apartment with, for example, that kind of, a gas stove and a gas heating, the levels of indoor air pollution really can be very substantial with nitrous oxides. And then we forget anyway that indoor air is much dirtier than outdoor air. And yet, because it's not regulated, we don't pay attention to it. So I think this would be an area we can begin to work with communities on. Back in the 1970s, when you had kind of the first Arab oil crisis, buildings were built so that they were sealed. Maybe that was good in some ways, but it was terrible related to air quality. We've learned one thing from the pandemic for sure, is that you need air circulation. And that's something I think going forward we have to work with.
No, all really good points. And you've been a champion on these issues for a very long time. And it's no, seriously. And, it's been very inspiring, to hear you even back on councils and advisory groups at NIEHS, for years. And I really feel as though the international view of that, especially in the US, was not as ramped up as I hope it is now. And I'll say I've even been enlightened in the last couple of years with the indoor air piece that you said with cooking and natural gas, and looking at my own kitchen and, and wondering why isn't the case that every stove that's natural gas also come naturally with a hood, for example? And that's just not the case, right? Maybe that's not the answer, but it just seems like, some houses have them, some houses don't. Some houses opt for other things instead of the hood. And to your point, these are, if you will, even luxury decisions. A lot of folks don't even have the ability. They just need to get food on the table by any means.
Correct.
They're not thinking down the road, right? So that's for us to kind of be making it so that these decisions and these impacts are not even something that hopefully a family even has to think about, because it's so naturally a part of just how things are done and the protections are already there. So thank you for lifting all of that up. So Linda, who is someone that you, and I'm sure there are many, right? But who is someone that you admire and why?
Okay, you may find this surprising, as you know, I'm Jewish. Pope Francis is one of my heroes.
Oh, that's good.
I have made several slides that I use from his Environment and Climate encyclical from 2015. He's done several other things.
Yep.
You know, he is a chemist by training. I believe he has a master's in chemistry. So he has some appreciation and recognition of the importance. So he's one person. Another person that I really admire is the Reverend William Barber, who leads the Moral Majority effort. It started in North Carolina, but has extended elsewhere.
Mm-hmm.
And he's not afraid to speak up. He's not afraid to be arrested. Mm-hmm. You know, he does believe in passive resistance, but I think his viewpoints are worth all of us listening to. He has some very important points to say, and a lot of his focus is dealing with the more vulnerable parts of our population, and all kinds of vulnerability, not just African American, not just Hispanic, not just elderly. I mean, he's looking more broadly. And I guess a third person who I think is terrific is Gina McCarthy. Gina was the administrator of EPA under the second Obama administration. Gina was no nonsense. She was never afraid to speak up. She was willing to change her decisions if you could, you know, present her with why that they were problematic. And I can give you an example with the Children's Health Centers, which NIEHS and EPA co-ran, and EPA was dramatically cutting their contribution by 80% or more. And they were just going to totally leave the partnership. And it wasn't that they weren't interested, it was just that that's how they were going to spend their money. And when I went to Gina and said, Gina, we're just at a children's center meeting with me, and you talked how important this is, how can you do that? You know, when you're the administrator of a huge organization, you don't know everything that's going on down at the functional level. And she was able to help improve that situation and bring about a change. So I've just found her very, very inspiring in many ways, and her willingness to speak out. So those would be three recent people that I've been thinking about a lot lately.
Yeah, all good ones. Thank you. Wonderful, wonderful. Going back to research for a minute, when you have gone through this life journey of, you know, really being a part of, I think, some very influential pieces of research that have impacts, right? Public health and even policy down the road. What are some, or what's one, or what are some that jump out that you've been a part of that you really believe either are or have the potential to have true impact?
Well, I think some of the work that I did with dioxins and PCBs, where somehow the toxicologists were looking only like at the administered dose, or what you took in every day in your food, or what you drank in your water. And they weren't thinking about that. As pharmacologists have known for a long time, it's really what's in the body that counts. And so I was able to, I believe, some of my research and writings were able to change the dialogue so that the body burden is now the term that's used when people are comparing, for example, animal data to human data. And you can make the calculations to go back from what's in the animal to back to what they were eating, for example. But that was kind of a new way of looking at things. I think I was one of the people, I wasn't the one who originated it, but I was certainly one of the people who promoted the relative potency approach for dioxins, which has allowed us to treat complex mixtures of dioxin by a single approach. And I would say that going forward, you know, we treat PCBs as a single approach also from a regulatory point of view, even though we know that they don't all do the same thing. But it's a way to move forward. And we're now dealing with some other compounds, and I'll come back to the PFAS in a minute, where there are 9,000 of them. And there's no way that we can test every single one. We can't even test. It's taken 40 years to get information on 2 of them. Well, that's not a way to move forward. We have to use different approaches. I think another area that I had a real impact in was the flame retardant area, especially the brominated flame retardants, where I wrote a paper with one of my students, I think was published in January 2004. And the question was, it was brominated flame retardants, should we be concerned, with a question mark. And I keep threatening to write a new paper that says yes, we should be, because what we've learned in a relatively short period of time is that these are not things, first of all, they don't really work if they're used. You know, if 50% by weight of your product was the flame retardant, yeah, it would probably inhibit. But when it's 3% or 2% or even 5%, it doesn't. And they have adverse effects as well. And then I think kind of mentioning the PFAS, which are a very different kind of persistent organic pollutant than the brominated flame retardants or then the dioxins or the PCBs. But frankly, I think the PFAS make the dioxins look easy because of the numbers and the complexity. For dioxins have a single initiating mechanism of action. And if something doesn't do that, it's not going to have TCD-like effects. But with PFAS, we're involving so many mechanisms, initiating mechanisms. It's really much, much more complicated to deal with. And I'm thinking that we really are going to have to move forward. And I had done the same thing with some of the halogenated flame retardants, where I basically pushed to start to take a class approach, or at least a subclass approach as we move forward. So I think scientifically, those are some of the impacts I've had. I was very lucky when I was at EPA, although I was there for over 19 years and I ran the largest health research division. For 1 year, I was detailed to run a human studies division. Well, you know, as a toxicologist, I never did much with human studies. But here, not only did I have epidemiologists who were reporting to me, so I learned, which makes me dangerous, a little bit of epidemiology or the importance, but we also had a clinical program where we actually intentionally expose people at times to certain kinds of air pollutants, less than they'd get standing on the street corner, but still in controlled chambers. We did some exposures to certain kinds of chemicals that we could follow to understand kinetics, again, at levels that were below a regulatory limit. That was it turned out to be a great opportunity of learning for me. And I think really helped me later on when I was recruited to NIEHS. So
I would agree. I wanted everyone to hear that because I know that's just a snapshot, but this is one person, right? This is one career path. Again, I think the world of our environmental health researchers, our researchers out there who are helping us tremendously navigate these very complex situations called life and health and public health. And then for the rest of us to then take that amazing research, some of which at times we're a part of actively, and work to translate it, right, with our researchers into effective public health strategies, policies, child protective, situations, and not going through these same cycles of when we know better, right, and when the science evolves and lets us. I hope you do come out with that paper on dioxin, because I think you have a lot of legs to stand on, unfortunately. But so, what would be your dream position? Whether that was back or now in your life, or, I
probably have to say, being the director of NIEHS, I was there for it was closer to 11 years than 10.
Okay, yes.
I loved it. Nearly every day, I loved it. I had, great people that I worked with, both, at the Institute and our grantees and stuff. There was, I think, a real feeling that we were making a difference, not only for our country, but for the world, that we were pushing the knowledge levels. I think one area that I would love to have more impact, and I hope I'm going to as I continue to talk and write and work with people, is that we as Americans have a kind of, what I would say is a not fully developed understanding of risk. Everything has risk. And I do think we have to start thinking about, well, what are the benefits and where do the benefits justify the risk? I'm not going to go to what I would say are kind of trivial examples about, it's more dangerous to ride in your car or something. That's not the point. But I mean, I think we need to be working to bring about some societal change of how we view risk as well. So to talk about the PFAS, these are incredibly useful chemicals. Okay, they're heavily used in industry, for example, for many purposes. But do I really need my hiking boots completely water resistant? Does my umbrella shade have to be totally water resistant? I could back to rubber if I want total water resistance. And I think we're going to have to start beginning to ask, what do we really need versus what's fun and what's nice, and think about it differently. So there's this whole push now in some of the environmental groups to talk about essentiality. So, if something isn't essential and there are risks associated with it, maybe we say that's, then we're not going to do it. If something is essential, but there are safe alternatives, and that's a whole book of worms, because we know that there's been a lot of unfortunate substitutions where we've jumped from one thing that is bad, but we knew it was bad, to something that we knew nothing about, and it turns out to be equally as bad as worse. We're going to have to take advantage of finding safe alternatives. And then there may be some things where we said this is absolutely essential. Maybe it's something, a medical product, maybe it's a drug, and we just say we accept the fact that there's a certain risk associated with this, but it's absolutely essential. And that approach has been used with the Montreal Protocol, with the chlorofluorohydrocarbons, and I think it may be something that we need to think about as we go forward and help people understand. I mean, it's amazing. Everybody's willing to accept the risk of their drugs. I mean, all you have to do is listen to TV and hear these horrific, there's drugs being, advertised, and this will extend your life, or this will help you. And then you read about, at the bottom, it tells you about, well, this may, cause cancer, or it may make you sick, or it may, you may die. But people still take these drugs because they see a benefit which balances the risk. And I think that's a direction we need to move with, related to environmental change as well going forward.
Lot to digest. Thank you. Thank you. Very appreciate all that. So as we're rounding up here, I always like to kind of give back, right, to our next generation, our emerging leaders. This is, again, a lot to navigate for experienced folks, right? And folks are very concerned. Will there be a job in my field of interest? I've actually had students ask me in medical graduate program, should I go for another graduate degree? Because they're just worried about coming out here and what it's going to be like, and will they be able to afford their loans and their rent and, all the economic strife. Excuse me. What advice might you have for someone who's trying to secure employment in any of the fields that merge our conversation today? Do you see a boom happening with COVID? And let's face it, more attention and even terminology around public health than I ever have heard in the public space before, and even the general public wanting and a hunger for a lot of people to learn more. I hope there's more there, but what's your stance on that?
I guess I'm guardedly optimistic that they really will be a boom in public health and environmental health. I think most people realize that if their environment is degraded, their quality of life goes down. I think the problem is people not seeing how what they do today impacts their quality of life. They're not seeing the direct relationship there. And that's something we can work with people to help them realize and educate. But when I talk to younger people and encourage them going forward, and people say, well, what do you think are some of the most important characteristics? There are lots of smart people. There are lots of well-educated people. I think flexibility is a really important trait. And I think another one is compromise. Being willing to At times take a pragmatic approach, which moves you further in the direction you want to go, even if it isn't all the way you want to go. And then I guess the third thing I would say is be willing to take a chance. I think there's very few things that you do in your career that are irreversible. You know, if you're willing, if you do something and it doesn't work, you can do something else, or you step back. Yes, you may need some retraining. You may have to step back at a bigger level, but nothing is ever irreversible. And if you don't ever take a chance, how are you going to find out about the wonders that not only that are out there in the world, and the wonders that you may be able to do?
That's excellent. And even untapping that hidden talent and skill set that then combines your education and knowledge and hunger and passion. I mean, that's like the unique optimism for me. Wonderful. And I hope everyone is really taking that in. You had a lot of great themes of flexibility, compromise. I mean, I think that has to be the tone of the era we're in. I honestly don't see a path forward in a fundamental way. Clearly, half of our country is pretty much divided. It's not 50-50, but there's a lot of different views out there and a lot of different motivations for those views. But one thing what I go back to a lot as I sum up here, I was in a climate meeting, and this public health folks and NGOs and community groups and faith-based groups and very, very conservative energy efficiency type groups and very, very liberal other types of groups. When we all ran around and everyone said, why are you here? Why did you dedicate 2 days to come into DC and have this meeting? It was so awe-inspiring, but not surprising for me, because I find this often where even though we all had, there are many different views as far as motivating factors, one that was a unifier, whether it was the parent, a grandparent, just a community member who appreciates the young lives of the children that they come in contact with, everyone was there because one of the major motivating factors was the children, the generation of today, generation of tomorrow, knowing that we are not even scratching the surface of how we should be as far as responsible actors, for the children in our lives. And I know that you, as a grandparent and parent, we've talked a lot about, children and the needs to protect them and guide and shape their wellness and safety the best we can with the knowledge that we have. So I just can't thank you enough for your time, your leadership, your continued commitment. There's a lot of things you could be doing right now. And, it's awesome. We talk about you often as far as there she is again, she's getting out there, she's raising her voice, she's calling the questions, and we would expect nothing less of you out here in the public health space. So thank you, Linda, for that. And constantly being, what is that? The source of good trouble, I would say.
I'll take John Lewis's statement.
Trouble.
I think that, one thing I do want to tell everybody is you got to have some fun every day. Yeah. Now, that doesn't mean you don't have bad days, but basically, if you don't love what you do, if you don't have a passion for what you're doing, you should look for something else to give you that opportunity.
It's a very good point. And one thing I've seen a lot of you too is you have been smiling. And I know you've had some challenging days, and we used to joke a lot about how you should just get an apartment in DC, because you were here so often, but you were here and you always showed up. And at least what I always saw of you, it's just a pleasant view of what's at hand. Yeah, it may be challenging, but how are we going to navigate this through together? And that's always been very appreciated. So thank you, Linda. Really appreciate you, and looking forward to a meeting we have this afternoon.
Absolutely. Starting in about half an hour.
Yes,
so
I'll give you some time.
See you again.
Yes.
Thank you, Nse.
Yes.
Thanks. Bye-bye.
Thanks, everyone. Bye-bye.